In this video, I want to explain to you why some forms of drug administration or herb administration are better or more effective than others. So for most people that do herbal medicine, I'm focusing on herbal medicine here. So for most people that do herbal medicine, they rely on the oral route to administer herbs. Now, this is my anti-aging tea that I take every morning. Okay, I take it through the mouth, oral route. But there are other ways you can administer herbs apart from the oral route. One of them is through the back. I don't want to mention it, but I think you guys know what I mean. Through the back, that route. So I don't want the video to be flagged or anything for obscenity, all right? But I think you get what I mean. So through that route is another way you can administer herbs. But I want to delve into the theory behind that kind of drug or herb administration, so that you can understand, you know, when it is safe and when it is not safe to administer it in that way. So like I said, this is my herbal tea. I take it orally through the mouth every morning. It's an anti-aging tea that I drink every morning. So you see, I finished the glass. I usually take a glass of it. That's just residue, by the way. So I usually take a glass of the anti-aging tea every morning, if I remember, or if I'm at home. If I'm traveling and I'm maybe staying in a hotel where I cannot brew my tea, I don't make it. But whenever I have the opportunity to do so, I do it. Now, there is another way I could actually take that tea. That's the same anti-aging tea here, and it is through the back. And what I will need is a very tiny amount. So I brew it, and I take a tampon. This is one of my tampons, Tampax actually, and I open the tampon. Pour the liquid onto the absorbent part of the tampon and allow it to saturate inside of the tampon. Then I lubricate the body of the tampon, and then I put it in the back side and I leave it there. So that kind of herb administration is actually recommended for some particular types of treatments or some disease conditions. One, those disease conditions that require intense treatment. For instance, if the person is going to need a lot of herbs, one. Two, you are sure that those herbs, the phytochemicals in those herbs will degrade if it goes through the mouth. That's number two. Number three, you are sure that those phytochemicals are absolutely safe and they have what we call a wide therapeutic window. So you can think of a therapeutic window as something, this space between my two hands is a window, right? My head can go through it. This bottom is the therapeutic dose. This top is the toxic dose. So there is a wide gap between that, all right? However, there are some chemicals that the therapeutic dose is close to the toxic dose. So there is a very little window. You can see, very short window before it can cross into toxicity. Those kind of herbs that contain such plant chemicals should never be used for that route of administration, no matter how much it is needed, and I will tell you why. That route, I want to discuss the theory. So that route of administration through the backside bypasses something called first pass metabolism. Okay, so when you take a drug or herb through your mouth, it goes into your throat, down into your stomach, and a lot of things happen in your stomach. Then it passes into your small intestine, and then it passes through the liver. Now, while it is going through your mouth, into your stomach, into your intestines, it is being metabolized. So metabolism, think of metabolism as a way of breaking down things. So you have a large compound or a plant chemical like this, and it splits it into different fragments by the time it passes through that. And by the time it passes through here, liver, gets into your bloodstream, it will either be so changed dramatically, or it's the first pass metabolism, where the metabolism will take place all along, because even from your throat to your stomach to your intestines, there are places where metabolism can take place, but the major place is the liver, where everything is changed and broken down. And you find out that the parent drug or the parent compound that is the therapeutic substance, by the time it passes through first pass metabolism, if it was this amount you consumed, the amount that will be getting into your blood will not be more than this, a few drops, and that might not be effective to handle that disease condition. Now, cases where you can use that type of administration is if you are, for instance, treating fibroids, which is difficult to treat and requires a lot of herbs, and if that patient needs extra support, you may have to administer through there. All right, so when you administer through there, it bypasses all the places where it can be broken down, and it is exactly what you administer that goes into the bloodstream, because it doesn't pass through the liver, it doesn't pass through all those places that break it down. All right, so what you do is you have that tampon, you saturate it, you can see it has turned brownish. You put the liquid on it, saturate it, let it be soaked very well, and then you lubricate this and you insert it into the backside, and you leave it there for maybe 2 or 3 hours. By then it would have absorbed all the plant chemicals that are going to act, and those plant chemicals go straight into your bloodstream and begin to act on that disease condition. And after a while, when you are done, what happens? You can pull out the tampon from there, and you can do it once every 3 weeks, 3 times a week or 4 times a week, maybe every other day you can do it. And yes, so that's why sometimes you go to the pharmacy store and they give you suppositories, that you put there. It is a different dose that is in the suppository. Now, a word of caution: remember, I said it's not in every case. I read a situation where some people are actually using it for alcohol, okay, to get high. So they put the alcohol there and they get so high that normally they are taking it through their mouth. A lot of the negative effects would have been removed, but this one doesn't happen, so it goes straight into their bloodstream and they get intoxicated and they get poisoned by the alcohol, because it's too much that is going into the bloodstream. So that is another way you can administer drugs or herbs, and it is a far more effective way than the oral route, but you need to be careful. You can only use it for herbs that have plant chemicals that have a wide therapeutic window.